My dear fellow Gibraltarians, ladies and gentlemen, this evening, following my return from London, the Cabinet met to consider the decision of the Spanish President, Pedro Sánchez, to declare a state of emergency in Spain from tomorrow to deal with the spread of the pandemic COVID-19 virus. That declaration vests important powers in the government of our neighbouring state in order to enable them to ramp up their work in controlling the spread of COVID-19 throughout the geography of Spain. In order to highlight the seriousness with which the spread of COVID-19 is being handled by the government in Madrid, the laws relating to the state of emergency in Spain give the Spanish Prime Minister wide powers of control in respect of movement of persons and vehicles, assets and powers to ensure the availability of essential goods for the population. The Spanish government joins the governments of countries like Italy and Denmark in taking bold, decisive steps to delay the spread of COVID-19, to do what they can to help flatten the curve and minimize the risks of health systems collapsing. Here at home, and while I was returning to Gibraltar today, the Minister for Public Health, John Cortés, has already been in contact with public health colleagues in Spain to offer our support and cooperation in respect of the work being done in Spain to control the virus. I've also been in contact with counterparts to offer support and cooperation. Our lines of communication have been and remain open, friendly and collegiate. COVID-19 knows no borders and discriminates against no one. We must cooperate in order to best deal with this issue. In the coming hours, I will be in contact also with political representatives of the region around us. There are no plans or indications that the frontier will be in any way affected by this measure from the Spanish side. Gibraltar has no plans to create any restrictions whatsoever on entry at our frontier arising from this measure or by the wider spread of the virus in Spain. Do not believe untrue statements that suggest we might be implementing such plans. We are following the science. There is no other way to handle a situation like this. We have the benefit of the many experts, locally and from beyond our shores, on whose expertise we can count and on whose recommendations and advice we must act when the time is right. We are clear that the virus will inevitably soon be spreading in Gibraltar if it is not doing so already. Stopping COVID-19 at the border or at any other entry point was never an option. The focus of our efforts now is on slowing down the impact of it. But it is important that any Gibraltarian or Gibraltar resident in Spain that you are aware of should familiarize themselves with the effect of the declaration of the state of emergency in Spain and what it does and does not mean. The fact is that we must move to do everything we can to delay the spread of the pandemic virus in our own community. That is why tonight, all our elderly residential care facilities are in lockdown. This afternoon, when I landed from London, I met with representatives of the Chamber of Commerce and the Federations of Small Business, as well as the GBGA. I've also just briefed the Leader of the Opposition and Ms. Hassan Naon in a meeting in the Cabinet Office. On Monday, I will announce a package of measures to seek to assist our business community in dealing with the economic impact of the spread of the virus throughout the world. Tomorrow, I will meet with the representatives of Unite, the GGCA and NASUWT. I know that there are different views about whether the schools should remain open or not. I have to emphasize to you that the advice we have from public health professionals is that our schools should remain open. The advice from the Department of Education is that there is no reason why our schools should not remain open. If we close the schools, the advice we have is that we will push the virus towards the most vulnerable in our community, who are the very people we are seeking to and must protect at all cost. We will also encumber those who we need manning our essential services with issues relating to childcare. It is therefore the opinion of the experts that on balance, at this stage, weighing the potential impact and benefit of school closure against the potential impact on human resource availability and the likely increased contact between school children and the demographic most at risk from coronavirus, the schools should remain open. You may have heard the Prime Minister Boris Johnson speaking about the new delay phase the British government is moving to as it works to tackle the spread of the virus. They explain the basis under which most schools in the UK will remain open. The science tells us that the closure of schools will only have a marginal impact on controlling the spread of COVID-19. To achieve that marginal benefit, it is believed schools would need to close for 13 to 16 weeks. Such a closure is a very difficult, high-impact initiative which would test the resources of most families, especially those with two working parents. Whilst closing the schools must remain on the cards as a possible future initiative, the danger of doing this early is that by the time we're experiencing peak infection rates, parents will have likely exhausted their ability to keep children at home. If we do this too early, we will save less lives. I am conscious that many of you will be thinking that just because that's the advice in the UK, it doesn't mean it should apply here. You are absolutely right. The decision to keep schools open here is one that we have made based on the Gibraltar case for keeping them open. It is based on the science, as we believe and our experts believe, apply to the Gibraltar context. It is, of course, a decision which is being kept under constant review too. Everything is. That doesn't mean that our schools will necessarily continue as normal. We will work with the NASUWT on matters relating to teacher absences and advice in respect of more vulnerable children, and of course those teachers who by dint of their own underlying health conditions may be required to take special measures. Schools may not be able to continue to offer the full range of classes, but for now they remain the best environment for our children to be in during this period of infection, even if the virus is transmitted in the school environment and from school environment to the home. We are not, I can assure you, missing the fundamental basis of the concerns voiced by many of you. At this stage, we must all be united in supporting our health professionals and not second-guessing the actions we are taking on their advice. We will nonetheless continue to keep all of this under review. Things are changing on an almost hourly basis. Any decisions to close schools will be announced by the government in consultation with the NASUWT. You should therefore not trust any statement on any social media site that suggests that the schools will be closed, unless you see it on either the government social media channels or my own personal media channels. If it isn't in the established national media and on the national broadcaster, do not believe what you are told or what you are reading. Do not fall for irresponsible fake announcements in this or in any other respect. We are keeping nothing from you. We will not keep anything from you. Trust us as your source of information. Already, you will have seen that we are providing you daily updates via Gib Telecom. I expect to convene Parliament next week to take further measures to provide us with additional powers where necessary. I have agreed with opposition MPs this evening that the meeting will be held without questions so that we are able to produce legislation where necessary and appropriate. I will say more about this on Monday. But please bear with us as we act in order to discharge our first duty as your government, to ensure the safety and security of our people. For now, we must all be clear as we go into a time which will be different in many ways to what most of us have lived through in living memory. We will get through this. There will soon be a vaccine. We will soon be able to provide all services as we did before. Let us show the best of Gibraltar from now. It's time to come together in the common and public interest. Let us use this time to protect our dearest relatives and friends. Because the harsh reality, as the Prime Minister stated yesterday, is that we are all likely in the coming weeks and months to lose relatives and loved ones before their time. Please ensure you do the right thing to protect the most vulnerable in our community, your parents and your grandparents. Those who are elderly or infirm. Let us keep the vulnerable safe. Let us be conscious of the extraordinary efforts of our public health professionals and our public servants. The hands-on leadership of Krish Rawal, Sohail Bhatti and Paul Balban has delivered an unprecedented number of free beds in hospital and a 500% increase in the ICU capacity that we have available. I thank every single one of our health professionals now on behalf of all of us. Please help them in any way that you can. And let us look forward to better days, because better days will come. On Monday, I will say more about the additional measures we will be taking. But please, for now, keep calm and carry on dealing with this issue together as best we can to protect as many of us as we can. Follow the advice of public health professionals. I will now take questions from members of the press.
Chief Minister, you've just said keep calm and carry on. There's been panic buying today. One of the measures in Spain is to ration. Of course, we are very susceptible to the frontier and to the supply chain carrying on. How confident are you that people should not be rushing out and panic buying?
I am absolutely certain that there is absolutely no need to go out and panic buy. The supply chains are not affected by what is happening. The idea that you're going to somehow help the vulnerable in our community by going out and buying more toilet paper and more baked beans is absolutely ridiculous. What you need to do is follow the basic simple advice about washing your hands, sanitizing areas, and do not go, as an act of love, do not go and see those who are in the elderly demographic. That is what we need to be doing. We don't need to be in the supermarkets. We need to be away from the most vulnerable in our community, and we need to be supporting our public health and health professionals.
There are many of those vulnerable within our community that live on their own. They live perhaps on the upper rock. What's going to happen to them? How are they going to get there?
We're going to be able to reach them when they need to be reached. We're going to be able to provide them the service that we're going to provide. We are changing the way that public services are delivered in Gibraltar. We're gearing the public services of Gibraltar to deal with this situation, to deal with what is coming, and to provide the help that the most vulnerable will need. You know the statistics as to how it's going to affect different age demographics. Well, you know, therefore, that we need to be protecting people in a certain age group. That's what we need to be doing.
Chief Minister, you've said that you don't expect any restrictions at the border. But of course, restrictions north of the border might affect a lot of the healthcare workers who are Spanish, who provide the services here in Gibraltar, both in the hospital and in the elderly care services. What resilience have you built into the system to deal with that?
So I've said two things. I've said that I neither expect to see restrictions at the border from the part of the Spanish authorities, nor that Gibraltar expects to impose restrictions itself. Therefore, I believe that there will be an entirely flowing border and that we will be able to have all the health professionals that we need in Gibraltar. Already in my discussions with Prime Minister Johnson, we've sought support at the level of health professionals as well, in order to ensure that if it did come to pass, that the eventuality meant that for other reasons, or indeed that reason if it were come to materialize, as things change constantly, we were to be able to, or need to call on the United Kingdom for health professionals, we will be able to do so. But we've also, as you know, opened the bank capability in Gibraltar. We're asking those recently retired to come back on our books. This is an all hands on deck situation. This is the reality of what we're dealing with this weekend. We are starting the process of looking at this virus starting to move freely in our community, and we are ready to deal with that in order to try and achieve what we need, which is to slow down the curve of attack, the angle of attack of this virus in our community, and trying to keep it away from the most vulnerable in our community.
Chief Minister, you mentioned that elderly services would be on lockdown tonight. This afternoon, you've also announced the closure of bars, etc., a curfew for them. So is this a step towards a wider lockdown in Gibraltar? Can we expect further measures of this kind?
I can tell you that I think this is the beginning of a period which is going to be extraordinarily difficult. I think tonight things will not be normal, but things are likely to get more abnormal in the future in the context of social distancing. So that doesn't mean that people need to go out and panic buy. It means that we need to try and create social distancing. Now, how do we do that? We do that by asking catering services not to be provided in the way that they usually are. We are asking people to obtain takeaways if they want to have delicious food from a particular restaurant. We're just asking to keep people away from sitting down together in an area where there may be strangers. They have no idea where those people have been, and in that way try and stop the angle of attack that the virus will have in our community and how it will penetrate in respect of the most vulnerable demographic in our community. But this is the beginning. This is not the end. We have not seen all of the measures that we may need to implement. The reason I may go back to Parliament is to get more powers in order to be able to implement even more measures as we go forward. And I'm conscious of the fact that such measures have an effect on business, and that's why on Monday my statement will be almost a mini budget to try and relieve the pressures that business will have as a result of these measures.
Perhaps a very quick message for people who say this is not worse than the flu and that we're overreacting.
I hope in future people will tell me that they were right and we were all wrong, and that I can be accused of overreacting. Unfortunately, the science does not suggest that they are right. The science suggests that this is much more virulent than the flu. And then when you get it, if you're in a particular demographic, you are very unlikely to survive it. And so therefore, I'm sorry to say that those who might be flippantly taking that attitude are not helping our community, and they're not helping our most prized asset, our most valuable people, our elderly, our wise. I'm moving to do everything I can to protect that demographic, and I would encourage every single Gibraltarian to do exactly that. And if people want to cynically pretend otherwise, they should go and do that somewhere else.
Thank you, Chief Minister.
Chief Minister, is there going to be any attempt to try to curtail like the entry of people from countries like Italy and other parts of Spain?
I think the world is moving on from the curtailing of movement of people from what might have been at-risk areas. This is now quickly becoming a pandemic in reality, not just in theory. The virus is everywhere. Therefore, pretending that you can keep people out because in that way you'll stop it from coming in is, in my view, entirely fanciful. It's almost like King Canute, whipping the waves to stop the tide from coming in, or pretending that you can blow away the clouds. That stage is over. There is no question of international containment, and there's no question of us besieging ourselves to stop the virus from coming in, because the virus, I'm very confident to tell you, is unfortunately already here, and we just will now soon start to see it being propagated in the numbers that we'll be announcing in coming weeks and months. But you don't need to fear that. We're likely all going to get it. There is no reason to worry that you might get the virus. The concern is to keep it away from the vulnerable demographic. That's what we have to do. So this is not an incoming plague that's going to kill us all. We mustn't think that. We mustn't get ourselves into that frame of mind. It is a virus that's coming. Most of us will get it. Most of us will recover quickly and easily from it. Some of us will have a worse case of it, but the particular vulnerable demographic is the one that we have to be careful with.
What sort of support has the UK offered in the meetings you had this morning?
So as I announced yesterday, the Prime Minister was fulsome in his support for Gibraltar, in particular in relation to issues relating to coronavirus, not just Brexit. And indeed in the JMC this morning, we've talked more about that, and I've written to the Prime Minister, as he asked me to do, setting out what are the key things that Gibraltar needs in this process. Ladies and gentlemen, thank you very much indeed. I will be making more statements during the course of coming days and months. I'll be making a ministerial statement on Monday. Tonight it is important that people who live in Spain or who are going to Spain should familiarize themselves with the powers that the Spanish government has taken or will be taking tomorrow. It is important that we understand that we need to cooperate together in this part of the world to stop a virus that affects us all in the same way, affecting those most vulnerable in all of the communities around this magnificent part of the world. Thank you very much indeed, and good evening.